for the practicing clinician, let's say that's in the community, and does not have access within their institution or hospital to a clinical genetics team, can you map out for us what the testing paradigm would look like? Are you doing extended testing for everyone? Are you starting off with a risk-based stratification? And then at what point do you involve your clinical genetics counselors, particularly, let's take off your clinical genetics expertise for a moment. Can you walk us through what that testing paradigm might look like out in the community?
I think we're already experiencing what happens out in the community, which is people, a high proportion of people who are coming to us, as a tertiary center, who are having their diagnoses made outside. At least the higher risk patients, the younger patients, have already had their testing sent before they even arrive. And so, one can have a conversation about how much pretest counseling is really needed. Particularly if you have a panel, because most people don't counsel for every gene on the panel. Mm-hmm. So I think so we are seeing people where testing is already being done by local clinicians, OBGYN, I have had radiologists send testing before the person got to us. Now, they have the advantage, those patients have the advantage of subsequently landing in a place where there is expertise where maybe others might not. I think that if one is uncertain, then the better part of valor is probably just to restrict the number of genes that you test, right? I mean, if you test for the fairly canonical 9 breast cancer predisposition genes, then you're unlikely to wander into the woods of what to do with some gene that you've never heard of. And also, it's likely that you would have enough local expertise there. So who could a clinician test? Again, I think everybody who's young, everybody who's under 50 could still be offered. And then, in certain circumstances, you might want to extend that if you think that somebody could potentially be a candidate for a targeted therapy intervention. And using clinical judgment about that balance between probability of finding something versus concerns about ambiguous results or difficulties counseling.
That makes sense. Thanks for sharing that insight.